Insurance Authority. Doc, akwa about home to saying.
Obi. In fact, me bano me catch me brother back with Jumu.
Yes.
You fair no Lawe.
Okay.
Or the estate department.
Okay.
And I me catch and say, me kai say in the Old Testament, you know, there was one woman, one prophet, Ebo Anuma Onyaba. Na akra no be yare and akra no ofri mu.
Okay.
Enti I think me catch and so on the exact quotation of mama. And wa senior mama. I think it's 2 Kings.
2 Kings, okay.
Chapter 4, 17 to 36. Now there is one lesson I'm say embed the lesson. You see, let me start from 80. And the child grew. Now it happened that one day he went out to his father to the reapers, and he said to his father, my head. So he said to the servant, carry him to his mother. When he had taken him and brought him to his mother, he sat on her knees till noon and then died. And she went up and laid him on the bed of the man of God, shut the door, and went out. Then she called to the husband and said, please send me one of the young men and one of the donkeys, that I may run to the man of God and come back. Now, so he said, why are you going to him? It is neither the new moon nor Sabbath. And she said, it is well. Then she saddled a donkey, said to her servant, drive and go forward. So it was when the man of God saw her afar, that he said to his servant, Gehazi, look, the Shunammite woman, please run now to her and say to her, is it well with you? Is it well with your husband? Is it well with your child? And she answered, it is well.
Yeah.
Now, when she came to the man of God at the hill, she caught him by the feet. But Gehazi came near to push her away. But the man of God said, let her alone, for her soul is in deep distress.
Yeah.
And the Lord has hidden it from me and has not told me. You see, the woman told the others that assembly
it is well.
But when she met the one with the solution, then she said, it is not well at all.
Not well at all.
Obi enye bia na ebisa said then okoso okasa bebre. Enti the past few days insurance and doctor you see former president Mahama say insurance enye juma then na ekosu obi afrem si munya aboteri everything is cool. Obi munje na Thursday dura say me wasem bia me share obi abekacha enti say why you say Elisha Obi me share na obi say doctor bibia okay am say bibia fine. But say me draw some power Obi. Because you don't have to speak every and anywhere. Is the lesson.
Yeah.
Now sometimes assemble nyabote kakra. If the forum can provide you with solutions, it is enough to speak.
Yeah.
And to be my ban and Elisha na Messiah.
Elisha, obviously Elisha.
Makwana ngobose we wunu me bana ya shoko ya ni be faso.
Yeah, but I watched a video of Honorable Kwabena Minta Kando, Baby Obia Mayenchano, MP for the Dwaboso constituency and ranking member on the Health Committee of Parliament. At the time, I think that former President Mahama Akwane constituency, Church of Pentecost, was Dwaboso auditorium no mu yusu here, and your presentation on the whiteboard, as it were. Issue data be the money pana gather no, but getting to 2021-2022 of that presentation, no, it looked a bit frightening. Now, or kase out of sika buying inya, 2021 6% per sika yes statutory was our buying or bre NHIS, 6% per, and he made another point. Even in 2022, the is 0%, and any Ghanaian who watched that, no. Legitimately was scared. Say, hey, what's happening? Are those figures I will show you correct? And what is the state of the National Health Insurance Scheme?
Obi, Maminda wasi. Na Aminda, Miami brother Dominic asi. Na you are Maminchia Miami wafa.
Yes.
Honorable Abakwata.
Okay.
Obi, oya me wafa bakupe. Miami Shano.
Amen.
Omana wonding. Na akwanya obi o Ghana nyina ondi nanim na legacy ni nyekesie na machia amakwata no na machia o brother o mahini obi mafino papa na me hu obi a na funu kama pe na makai no nti bi owo no me channel obi miso me share video no na mpese me magana fonti ase say National Health Insurance Scheme no eye ejuma pa. In fact 3 days ago na me ka chere me say on mami obi a wo fie no ne card na me fan share me wallet mu na me hwa ma ho say we are covered and safe. Obi a me ni me household 7-8 people obi a wo card in branch a me di hear me politics obi a obe me obi a ma ye card amount because we need say health insurance asem toa the best gift at Ghana e wo ma Ghana for since 2003 I setting up obi o share presentation account here now on my say o share bibi say 2013 amount sky collect here is about 830 million. You're releasing 492. Now percentage released 59%. And Oka say 2014. In fact, Oka 2016 was the highest, 86%. And all bad down Oka say 2021 there. Sika is a car health insurance.
No, 6%.
No, 127 million.
Yes.
6%.
Yes.
Obi, Mesrel. Before can be say the devil is in the details.
In the details, yes.
Figures now are candle. Edit 2 figures need correct figures. But interpretation, any the opposite on catch with all due respect, is not true.
Okay.
Now, Obi, Usha 2021 budget a year or national health insurance. Sky can say the whole of 2021 Obi. Now a 2.6 billion.
And no, our budget no would include claims payments. Okay.
Vendors ni bibia.
Okay.
Now 2021, say because of central government COVID in our releases no.
Yeah.
Yeah, percentage anya no from we were about 41%. But also 2022 release anya 2 billion out of 2.9 billion.
Okay.
That's about 69% of Sky here no was released to us.
That's for 2022.
For 2022.
In the 0% ne.
Enti me be chiamu obi. Enti the one say national health insurance from John Mahama time, in fact from President Kufuor time up to Eneno. Obi ani wa sika oji eni nyina odi mine e insurance. Obi a tuebi na unfortunately ebi aka central government na ebi a odi aya kwan ana odi a build schools ana odi aya bibi fufura o mine no person onye. But not din e da sika ni so national insurance levy. Now under President John Dramani Mahama Sebi Usha 2012 say ye 900 million. You release 609 million. Sorry, me can not account of the way me can budget for the year.
Okay.
Budget no was 900 million. They got 609 million.
Okay.
Now, just 68% of Ska Munya and
Yedima. Okay.
Now, also honorable account how do we call it?
The presentation.
The presentation, no. 2012. In fact, I'm not quite from 2013. Almost 830 million reported collection. Release is SCA 492 million, which is 59%, less than 60.
Yes.
The Akano coin. Say no BBC and also. And on a yedi for playing in your question is in 2013, President John Mahama president sa 830 million. I had to less than 500 million. Over 300 plus million. Omo the year then. Dr. Okoe-Boye can say President Mahama the far jets edi won numa enye kasa eye ehun ti ana sebi eye anokware. Ebia ska all the share school building be project. And a road construction be a contractor no GOG project. A jada so I was saying here critical road. And now ebia soldiers and relief operation and nadmo. Point in say insurance din was scan so. Now so sometimes you know I buy over the years it be the insurance scanner then for. Now the entire 6% no be mo be me chemu. In 2021 obi.
Yes.
Arrears another health insurance. Obia sika want to the odikoye bibi aya di sebi mama de account no. The arrears in total obi 3.7 billion till for 2021.
Total arrears.
Arrears. That's from 2013 and before all the way.
Okay.
3.7 billion. Sky was say Embra National Insurance. Amount you releasing in 2021 hit the account 1.39 billion. Obi But this what happened. That 1.39 billion only 127 million and in the name of tax levies in that year 2021.
Okay.
So if you take that 127 million as a percentage of the total amount, IAG was 2021 D1 6%.
Okay.
Meanwhile, Oba National Insurance, your account make it close to 1.3 billion. Now, so said we share on our account, Obeka was 127 million. Because onusi or shesika scan actual 120 yes where opeska actual 2021 levy and although out of the 1.3 billion about 1.2 billion now actual 2020 din also and I mean 2021 he is not interested in that or no you see scanning in 127 per and not ni dino 2021 NHIS tax. But what I say? 2022, so by the end of 2022, national insurance sky from January to December, 2 billion Ghana cedis. But honorable account say 2022, no, so I mean 2022, January to December, we had 2 billion Ghana cedis. Obi, your budget and say need for the year was actually 2.9 billion.
And amunya 2 billion.
Yes, but honorable account, I can't tell you say, Ushe percentage that. Health insurance Okoe-Boye 0%. Or compare say scanner heading man with the whole of 2022 or pesika actual 2022 one be. So 2 billion na minya 2022 ni na sika actual 2021 any kakra be 2021 2020 di won. So point na me say anytime who can say o pesika actual 2022 now we dey compare the total current 2022 no. It continuously will be going down because over the years, arrears be. And the my passion can say politicians unfortunately say be election be draw. Because of insurance, no, gu. Meanwhile, no be. Me the figures now, just last week Friday, Obi, Friday, 28th of April. National insurance just a week ago we paid 230 million Ghana cedis 230 million 160,730 Ghana cedis
to as claims payment
for the month of September to all hospitals in Ghana. Obi,
over 200 million,
over 230 million. Now guess what, just 3-4 weeks before that, which is 24th of March, National Insurance paid 140 million Ghana cedis for August last year claims. Obi, 24th of February, we paid 128 million Ghana cedis just 8 weeks prior to that. So within 3 months, Obi, within 3 months, we have paid close to 500 million Ghana cedis. Obi, this is the amount of money we've injected into the health sector. Now, Adibakwa Eya Kakani say, over the years, health insurance, ye Tuesika, and this a get fund. I publish in the papers. I will say, Azimasi way, oh, yeah, Jumani, Amanu 20 million, Amanu 30, Amanu 100. Yet, you know, you're digitizing it now, and you hit your more account from your account straight into the account. No money.
Facilities, not accounts.
Account, no money alert. Papa, edem. Now, Obiya there's no place we're gonna have. I will be payments now. And you to me, she will be not so. Master 6 months in the see. Oh, say 230 million, and although it was just last week, it is in the name of September 2022. September. Now, Obiti, we are not really say, oh, and because I arrest in 7 months up to now. Hey, 7 months in here, Ghana hospitals, yet Yomuka. Oh, Chelsea hospitals, no, and me, Juma. Meanwhile, no, Obi. The HN say it's only because you're in the name of a month or 7 months old. Now, we send a health insurance here, Jumana, Obi. Mandatorily, we work on credit basis. Oshe Ghana ni asana udi no krata abre.
Na motria area facility no.
And facilities themselves, they use an average of 4 to 6 weeks.
Asana mo de aye omo claims ni bibia.
No mo de abre. And say show when May mo June ending, the earliest ena obi the kataba say obi share obi May ewo asinfo St. Francis Hospital, Catholic Hospital. Now on the June ending obi yes so say nhwem hu say enye say obi a fraud. Until we can also use about a month
to vet claims, no.
And to only have 2 necessary mandatory months now. A procedure, no. Just say health insurance as we speak today. Edika 5 months. Obi, sebi. Me person make comparison. But time I kufado yes when you know. Not the last time I went to hospitals. April of 2015. Sorry, of 2016.
April 2016.
That was the last payment. Now I hear under GM buying. Who calculated from April by the following year January our free officer is about 7 to 8 months.
94.7.
Doc, the other thing I'm person say apart from proceeds from NHIS, with the National Health Insurance Levy, no, a bar fund in the mono. Mosainya sika free baby into the fund.
Obi me da say before I remember hono. Before I remember question which is a very important question. Mamin can say as we speak. Because me per se, obia over in the chain of healthcare suppliers, or in drug hospitals, obia who sika hospitals on. Yeah, policy be or health insurance. Their friend is sunshine policy.
Sunshine policy.
As I say, who call your website? Who claims payment? NHIS.gov.gh. O click here, Obi. File no sky 230 million. Who hospital be a Ghana any amount I demand. It's a confirmation. Who say. Me budget some figure. Second for not 5 million Ghana cedis just in the month of April. For people in confirm how sure G in September 2021. Say what 2022,
yeah, 2022
because of 2023.
Yes.
Obi, ultimately Kintampo government hospital. It's our government hospital. But yes, our policy, providers now be say man say you bet me one share no more watch kakra. Because one share Sebi or any be grab to me as I can say director then say ya to account mu pay me my private facilities no so catch him say doctor ya private businessman no o di 5 million Ghana cedis to my account one sham Roberts ababisu enti ya ma omo password enti as I speak director general Ghana service Dr. Kuma Boaji okita password or call insider or all the money paid to all government hospitals in Ghana. And you know why this is important? In the past, or no director general or Nimska to Lekma hospital. And you call Lekma, Mika says on Omoye. Oba na bia director ka say masa enko ye ma eska bia enti na ye charge we enti na ye say
nzo be hwe na say omagiska enti obi because of that policy now Obia or Dr. Okoe-Boye are on your information. In fact, Okoe corporate affairs and the media, you can also access that file. Just that a nigga for the whole world to view. But if you put in an application now to Oswald Mensa, our director for corporate affairs, Obi, you remember file for April last week. Let me tell you, 230 million. Some facilities just last month, me 2 months claims. Just say every month, over teaching hospitals, they can be getting average 2 million sometimes a month, and some of them got times 2. We are paying some twice so that we can reduce the arrears further. Obi. Now, question Obi is important. The problem that Ghana has, this problem was there under President Kufuor. It was there under Jonathan Mills. It was there under John Mahama. We are seeing it now. Is that Sika Yeji Yatro health insurance one hono. And you know health insurance. Yes.
The way to solve that problem, 2 ways. This is what we have to be doing now going forward. Having national realistic conversation on how to solve our problems. Not so because I didn't go now first fanji power. Now still nentis. How do we get all the money to come, Obi? Petroleum funds now. The laws are stricter.
Yeah.
Until before finance minister ebe adjustments about parliament. Ebe ma reasons. Emma parliament, Emma no permission. And so that they go into some of the funds like heritage funds and all that. Obi NHIS plenty sir. Law no see tax be under core finance and so they buy health insurance. Over the years, every finance minister you see some level of discretion.
Yeah.
And to show no minor heska will be sometimes or they be coherent side to mano. The way to go about it, Makase, assuming we even amend the law and say that a third or a quarter of parliament, Sebi, I'm just giving a nationalistic solution, can trigger removal of, let's say, a finance minister. If one first carrying Obi, whether it's NDC or MPP, no finance minister would dream of touching the money. You see, Obi, because going forward, we are the youth. You're not future near idea. Those who want to lead this country, these are the things we want to hear, Obi. We've been in experiment, at least in the Fourth Republic, for about 20-something years. Obi, I always ask myself, what has the past been like? How can we change course? So this is the kind of conversation. What do you do? Say that when a finance minister, no matter how hot he is, he will not touch health insurance money. That is what we have to talk about. Because now, nyami mpaibo debi ame body say ombwa abai when break it. But some mpaibo na mbem na jom ama ba. One share 6% na kano kajo. Sane man on kabio. One share na kodru -37. Because the same thing is likely to happen. So one of the solutions is to amend the law so that before anybody touches the money, on him say it is easy to trigger some very irreversible
for his removal.
Exactly. It's one of a nationalistic one of the solutions. The other one, very key, Obi, and he say, as a country, recently we call South Korea. Now South Korea, no, you car about some percentage, about 4 or 5% of your salary goes straight into the health fund, into the health insurance. They buy a fund, straight. So now SNIT G, your influence, no, apart from NHIS, SNIT 2.5. Of pension by her. Okay. Now, omuhono ye chaos cover 5% eco fund, health insurance fund. Only part of the formal sector. Those in the informal sector. Or be a what country no, they put them into 3 levels. Level A high class. B a middle class, then economic standing. Yeah. And C a low economic standing. Ya cha standard bo amount. It's we high class, we a bank manager. And now you're private business. Now you show assets. Every month you catch us at 5,000 Ghana cedis to the fund. Okay. Now, because of that, 95% of scam we use for South Korea to pay hospitals, comes from contributions. It's directly in their coffers. They handle the money. They don't wait for any central government to release or transfer money like we have in Ghana. Now, the 5% of their population who don't have money at all, who are poor and now cannot pay, guess what? Government is the one who pays for them. I believe, say President Kufuor, health insurance, no person will be entering hospital. After 20 years, these are 20th year, I believe it is time to look at the policy. So that, Obi, as we speak now, 95% of Sky DH insurance now, in fact, let me put it at 90 to 95%, comes from central collections, either the SNIT money or Ministry of Finance. NHIS, about 5 to 10%.
No premium, no.
Yeah, premium, no. And now, Obi, premium, Okoe-Boye, me to about 18, about 18 Ghana cedis
for
1 year.
The whole year.
Yes, because
18 cedis.
In fact, 18 you cry the small charges account. Real charge is under 18 because I am a SNIT
contributor.
The only SNIT contributor informal or to about 27, 28 Ghana cedis. Now, he found out Odi over to less than 30 Ghana. Now, you call your operation and national. Or did you award a national? Your man in doing national. Now, any operation you know about review national or walk around nation. I mean, you see. What we are trying to tell ourselves, as far as we want to fund our healthcare only from taxes or from central government. Anytime central government is in a challenge position, it will affect our the operations or what you get. Now, I want to say here, by the grace of God, Sika Eba Health Insurance, so far in over the years, including now, it is enough to keep us very liquid and solvent to pay facilities.
Exactly. But let me ask this question.
The only thing we never count is if our releases improve our Obi, there's no disease in Ghana. It was saying cover. We can cover all conditions if our releases improve. And all I'm saying is that we can look at policy reviews. How do we have a system where we pay real money? Only say this 18 cities America was it has been there for about 12-13 years.
Wow.
Levy, you take your health insurance for transaction processing. Obi, some are 13, 14, 15 years old. Do you know why? Anytime Bobeka say, Muntu Suka Krana can say, hey, oh, you have for Chrome engineer. So with inflation, Sebi, who team ya worker, what your argument? Say yen two akwetiamu. Dr. Okoe-Boye insurance. Sika Ojinu for the past 13 years, Sika Ojinu ran Oji. So we are a country. We have to have real conversations. So if we are not careful, I cannot show you 6%, 0%. No, I can say meanwhile, no. Obeko Dwabuso. Me na me catch you. Fred Dwabuso hospital wo ene. Se nkrofo take hospital at 9
health insurance. Now hospital ne show mo.
Obi, now ensure mo so me to card nego. In fact, I have the statistics here. One of the ways you can tell say health insurance, confidence on for using Obi. Our coverage active or more register with health insurance, In 2015, we had a population of 11 million active membership. 2016 also about 11 million. 2017 and about 10 confirm we have 10. By 2019 it had gone up to 12 million. As we speak, last year by the end of the financial year, we had 17,161,000 Ghanaians on the health insurance, amounting to 55% of the population. In 2017 it was 37. In 2015 it was hovering around the same figure. And as for Akando figures, figures, we're sharing what choosing those figures because he's using the money we get in a particular year against the arrears for preceding years. Now, some arrears, from President Kufuor Sebi up to John Mahama, it will always give you an impression which is quite deceptive.
Mami Musa, this question because one my Akando data or share and what I say figures no correct by interpretation they problem into no one. Any in the muso say as NHIS said can every year must submit a budget for the whole year. Much a buying sika mu here to let the scheme run and run well. Now a buying so releases at the amamo. Good. From some releases a buying mamono, I believe say based on inflows are a core into a buying basket, i.e. NHIS levy and premium no say amount for two premium and also call finance minister and stay on more into a SNIT contribution NHIL part plus levies NHIL levies and the qua buying her and from that now buying AEB now or the fund them budget for the year good into the 6% account or the 127 a 127 of levy no contribution about more and now say generally 127 of them because I want to juxtapose that to Momo budget and modema buy Momo releases or
we say 2021 for example let's say 2022
yes
2022 your budget for the year was 2.9 billion. I know na esika munya mobile running scheme no for the whole year. Claims payment everything. Okay. Now 2.7 billion was supposed to come from central government.
Okay.
Now IGF
yes.
Premium processing fees are 200 million, now 2.9.
Okay.
Now this year 2.7 billion and a budget.
I am a budget. Okay.
200 million from our IGF. Now 2.5 every second. Now, 2021 now in 2021 Obi revenue collected our finance and reporting here 2 billion Ghana cedis.
Okay.
But before 2021 arrears just say NHIS kayaji tax ayaji I work at as
yes.
Now 1.6 billion.
Okay.
Only two no kawa only 3.7.
Sure.
But guess what? Sika released by health insurance in 2021 the whole year 1.39 billion.
Okay.
But out of this 1.39 anytime I release this car by account show was scan say sika where mama no sika in 2021. Sika be about 2021 so you show say where 2020 sika by the more in 2021. Now, out of the 1.39 billion insurance account in 2021, 127 million per and now sika in 2021 year no.
Okay.
But the account I have a 1.2 billion plus no. Dear was no just a car dia 2020 sika.
Okay.
Just 2020 no abanaji ebia or the year dem be but on to me jumping 2020 and can say, oh, scanner minimum on 2022. I was there almost scanner titidino and son of Bene. Aha, and I can't offer the year 2021 all those are year no ya more than 1.3 billion ya to hospitals ya to your staff abibia ko fine and as I said the 2022 credit health insurance e zero release sana one so far zero enti o tie account na o ti say hey 2022 health insurance Okoe-Boye just say release grand is zero obi impression kon say yenya hwe wo authority no me wa be do ka say 2022 the year no yenya 2 billion Ghana cedis but guess what 2 billion kana nya no ni nyina e ba ye no di ya obehu aya chiro wo omo frɛ no omo wo terms omo use in finance I'm sure you're a lot of educated listeners. So when they send you, they have they show you the year.
Okay.
Dia 2 billion anya for the whole of 2022. It's likely to be 2021.
2021.
80 for Sika Yaji 2022 pass 4 billion kana mache. Chese sa Sika no e wa ban wa ebia sebi all the year other things. But medru yo but no chese the whole of 2022 no Okoe-Boye anya any release. Release is number. Now so account the whole release osi ono enye no na ohwe open release date only say 2022 and I miss so much more say because mama time at times time obi ani wa watima tua scanning na ada no the oja ekemu no ye de ni nyina ba carry forward to ede and every year no one share year scan obenya no immediately it is made as a percentage looking at that particular year's count saka ebe negative and zero so obi all I'm saying is that me nka had said there here be a but me pinisu so say obi be kasati said here oba health insurance sebi me see an authority or an entity that pays an average of 150 million Ghana cedis every 4 weeks. Can you have the courage obi say school fee they need get fund some of the agencies are musui if they had a kind of chest I kita or health insurance show me you know, so I think there are factors ama in comforting look obi mami kind me the report no co-payments report no some me catch say a certain committee I call Ghana nyina I share the AC the entire comfort charges ka eno na sebi me minister e kasa ye na o make reference say yetimi giska on ho nema no ebi mutimi kasa insurance na go because e charge uska ba obi share the course wo Ashanti region Ejura district me boss hospital 2 members of the scheme were charged a total of 285 Ghana cedis for receiving medical care. Official receipts were issued. Now, when the issues, this after our district team had gone to the hospital management, the issues were brought to the attention of the management of the facility. And after a week of investigation by the medical superintendent and the administrator, the amount involved was refunded to the complainant. Obi, what does he tell you? Chese, sika wea yeji somewhere in the Jura Ewa Ashanti region. Nipa na oji skano ni jina so. Obi okita card. The age only found this can say on him say health insurance bet channel for nipa na washe no. But because Okoe-Boye engineer Jura hospital in wafa kwa mbiso ajiska. Yes.
Yes, my team no. Quickly after 1 week, Omo Frabante Zebra, Jiusi Kanako. This has been captured in the national report I have on my table. It is to tell you that once nipa na edi ye juma obenya some 1 or 2 hospitals opepe kwa so ajiska wo bi ho we yan ko investigation ka o share na o na Okoe-Boye ntuame e na che na so say na me kan no na say me kan say me be publish and I wanted to publish the reports in the Daily Graphic the payments I do almost on nyabotema here enti me the Dr. Okoe-Boye kasa some of these reports I'm going to share with him. He is the head of the government facilities so that some of them he will rein them in first before I even come in. Sometimes even Dr. Okoe-Boye hospital be away bia so let me can say o hwe nkoso o be show mo account mo no na sika ato
baba omonso the hospitals would argue say because the whole NHIS payment system na kwa say a credit arrangement being to member service no later no mo the claims abana mo metua o mo ka invariably you would find say anytime o mo be pay o mo claims no na e bia the value of that claim no a diminish because it be a kabia a pile other one and also the kokotua and you find say anytime because our facilities we even though payment about catch actually and can something be done around the now because here say realistically say we mandatory be 2 months a day vertic claims be any free more the car duly be 5 months
Is that not too much of a long time?
Obi, let me say quickly that we are working hard to make sure by December we can reduce this 5 to about 2.
Okay.
But I was saying, India, who no kwere kakra. We a hospital. We see who shen for health insurance to you. Health insurance bet to you ebia 1,000. Make sure you when you see about 1,000 Ghana cedis for cesarean section, about 990 Ghana cedis. What you have to say? Who be operation insurance bet to you? I didn't think I was shani pana. Now was aji 900 Ghana one same. If because of the movements, Sebi gap na one, odi be to cry obi Sebi. If 100 Ghana na Okoe-Boye one hoa, it is possible say nipa no nko kemu to say the wajin 900 Ghana. Sure. And then even the 100 Ghana nukrano, we have to find ways to sit around the table so that we agree that because of the movement, the gap, the mandatory gap between processing and presenting, having your payments, let's agree on this 2 or 3% of the captured amount our health insurance will pay, which you can take at your facility. Okay. But this attitude that almost shy, obi because of discount my refund, obi because of me sorry, but and some of them honestly create the impression that for many months they don't get anything in their accounts.
But that is why maybe, just maybe, you should go ahead with publishing payments.
Okay, as you speak, we publish it online. The only thing is that we are using passwords. Maybe I'll still consult further to see whether I will remove the password, because now when you go online, you will see the file, but you can't enter.
Yeah.
Catch doctor my password now. We are obia. But initially, like I was saying, I wanted a situation where you can go there and know that in Okoe government hospital, we received this amount last week.
Again, for pharmaceutical
password.
Yes. How are their payments done? Hospitals in the Triamo.
Obi, me can say you friend me to a Ministry of Health because pharmaceuticals fund say inflation omo price in vehicle. And I make a minister, my boss, honorable. We don't have any contract with any pharmaceutical supplier. Yes. What happens? They say we almost share patients are no the bill now brand here. But they what government does that most of the drugs are given to the regional medical stores. Okay. And they supply to the government facility. And a government facility, let's say Chevi government hospital. A draw for regional medical store. It was so now regional medical stores, they are about central. Okay. Not central, at the pharmaceuticals. But look at this chain. If the Director General is not having a regular update of what Chevi government hospital has gone, you can have a hospital where this comes on regional medical stores. Pharmaceutical company could do now omaka is na insurance no 6 months
first come by is next car no more the other
exactly. So me person say sunshine obia enye in the know about what is happening. Now this request say almost mayen no open. In fact, based on our conversation, I'll go back for us to see whether we can review it. Any Ghanaian should be able to click. So that every week, every 4 weeks, insurance investing an average, and let me say it here, any entity that has the capacity in today's Ghana to pay 150 million Ghana cedis every 4 weeks. If you say it is insolvent, then really you are doing just politics. And the worst part of the politics is Obi, we make come because my Ghana hospitals, Obi Tieu, Sebi, Oye politics inti, who's insurance negu, or see uncle any card. Your rational call, one appendix, yen pine yema, Obi. Sebi appendix or insurance, ye try about 1,000 Ghana cedis. Or no, Sebi 100 kra on Kitebi. Okasa inti on Nibi. Say no, on this will be cry all card in Intia 50 Ghana. No crab is so. Only the only insurance in Sukra, yes, in the bill 2,500. Or done medical prisoner. On your documentary, that's how they call those people. And it makes no matter what the challenges of health insurance is, yes, sure say, yen funk or your politics. I bet Kasana was away and ye Juma. Forget about it. Whatever you will do, let's encourage our people to get on the scheme. And let's think of, for after 20 years, most of the problems are recurrent. Let's think of real. I've given you some hobby. If I had more power than I had, these are some of the things you put in place. Okoe-Boye, why is it that some of my pay I can't put it in health insurance for my health? I'm paying 28 Ghana cedis for the year for my health care. I mean, we have to get to a place where President Kufuor wanted the poor to access health. I believe Akufo-Addo has the same principle. Obi has the same principle. I have the same principle. The real work is that how do we get those people to be covered, even when we allow other models to be used? Yeah. That's what South Korea is doing. The state, they pay for 5% of our population who they themselves has verified that these people cannot even afford the time. And so I asked the CEO for Korea Health Insurance, how come you manage to have 95% of your inflows of your budget in your control and not from central government? You know what he said? He said when a lot of your money comes from central government, if you are not careful, the politician will take charge.
They will take charge. And that's where maybe Parliament Health Insurance Act, no? Ne wasanka yede yadwen ye call kakaba
me call have recently papa ba could share a policy cycle can be powerful or see a policy implementation is not an end in itself.
An end in itself.
So if you are sure never be in our 20 years, we are now even more in a better position to look at other ways of making the model achieve the same objective, but not through the same pathway.
Through the same pathway. That's true. Utie me now question be my Dr. Okoe-Boye, your WhatsApp line 0548 443 523 0548 443 523. You can come through with your questions now. Yemusa Dr. Bernard Okoe-Boye and 0548 443 523. It's a WhatsApp number. In the just do justice to the questions and the messages now. Ode brain ayashra kan ede amamuwe say obi. Can Doc tell us how much of the 2022 releases was allocated for 2021? Because in Akando's presentation, he should have added that to the 2021 money, and the percentage wouldn't have been 6%. Similarly, 2023 releases should follow same by treating indicated allocation for 2022, and the percentage will not be 0% as Akando sought to show. Kwame Eje Asante, constituency chairman, Okoe-Boye South. Obi, please tell Doc that my advice is that they should publish the payment in the newspapers and on their portals directly than for others to access. Okay, thank you. We say, okay, wait, no, yeah, they. Unfortunately, we are almost sending messages now. Mom Famudi and Count Christopher in Takrade or say Obi tell Okoe-Boye to stop peddling falsehoods because the NHIS is not working. Rosa enti Christopher or Takrade here for the now call yana enye ejuma, and then we can address those. Good afternoon, Obi. Could Dr. Okoe-Boye take the suggestion to the political leadership, the executive and legislature to pass a law to ring fence the revenue from the NHIS levy so that everything that comes into the account is released to the scheme? Augustine Yao Agbeneza and on the way Augustine Yao Agbeneza. Thank you. This one says, a happy birthday to Mr. Charles Kweku Entry Boahen, CEO of Cap Farm Ghana Limited. May you be blessed to your family and to the country. Okay, may you be a blessing. Kofigo, may you be a blessing to your family and to the country. Kofigo na way about Mr. Charles Kweku Entry Boahen, CEO Cap Farm. Have a really good birthday. Let me see if we can deal with the other messages here. We say, Obi, good afternoon. Please ask Doc if my wife has NHIS and she would be doing a CS. Will she pay something? CS is cesarean section. And also covered by NHIS, Doc.
It's covered.
Okay.
Yes. Our list, no. And cover 100% of medicines.
Will be here.
Yes. Okay. So you can have a situation where baby basina amount a particular drug. Any list. So we pay an average, like I said, over 900 plus for cesarean section. So if you got 100 cities because your amount BB any list, then that one is okay. But if a list you
don't have to pay for that. Yeah. Good. But how would patient know say a draw we want list?
We have a handbook.
Okay.
Patient handbook yendra yetshanyina ewomu. And my NHIS app no so phone so I ultimately download all the services and medicines we pay for.
Okay. OPK Patriotic Voices or GO. So Dr. Okoe-Boye has done well in coming out to debunk Honorable Akando's propaganda about the NHIS. Regards to Mr. Derek Kwekun cancer. Okay. Mami Shaway said, good evening, Obi. Who started the politics of health insurance? He should go back and ask for President Akufo-Addo, Aziz Ewusuhum. Let me see. We say Dr. Okoe-Boye, also no need for long talk. How much was received from Finance Ministry to the NHIA for the year 2022? Just tell us the amount released. That's all. One figure, keke. We are 5 months into 2023. Nanabi Ewu Islego. Nanabi, Doc has mentioned that figure.
2 billion Ghana.
2 billion Ghana. So where they can boss our figure, no? We say Obi, I'm paying about 3,000 Ghana for my health care every month in Germany. 3,000 Ghana cedis a month. And a Ghana, you have 28 cedis. Wow, for a year. Charlie, magician. So, but we say, Obi, good afternoon. Great submission so far. Please ask a doc for me. In Pong Katamanso office has been secured. Okay, an office has been secured by the MC, and he's ready to give it to the authority. A pickup to support their operations is all they need, and recruiting of staff so they can start operations bright in Oyibi. Look, about your attention.
Cool.
Work on it. Omanya office, okay. Well, Obi, anytime I renew my card, they deduct 28 Ghana cedis, even though I'm a SNIT contributor. Any explanation? Kinsi Yurenchi Wabeka.
28 no sudurana bisano. 28 for the year.
No, SNIT contributors they tier 28, no.
No,
for the year.
SNIT contributor it should be lower.
It should be lower.
Yeah.
But say Kingsley Yurenchi, the whole year 28.
You use iPhone the new year.
Kingsley 28 I was to meet you about 200 Ghana crowd the whole year. Hey, we say okay. This one says, Obi, I think he is referring to how you pronounce Suhum. I am Tete Asha from the History Department, University of Education, Winneba. And Suhum no. Okay, the abon is saying Suhum and Suhum. We say, Obi, please ask Doc if NHIS covers the following test: malaria, pregnancy scan, typhoid test, etc. Because at Bechem Government Hospital, they are charging clients for these tests. Nana kwesi ewo Bechem, Doc. So malaria, pregnancy scan, and a typhoid.
So the payment systems are used at health insurance.
Yes.
For disease conditions, we use the diagnostic related groups. That's DRG. Okay. What it means that the experts together with hospital managers.
Yes.
I can say obibana or malaria. How much do you normally spend to come to a conclusion on a diagnosis? Maybe I'll buy some tests. And you're sharing now abandon. Say let's say 150 cedis for malaria.
Okay.
So that 150 cedis for malaria is not you just entering the consulting room and the doctor saying you have malaria.
You have malaria.
It involves the few things you have to do, including the lab.
The lab. No?
Exactly. So strictly speaking, you should not be charged for the lab. But no be can say and I top up because meanwhile no rates rates are ni experts atnasi. I agree. I factor all the things that are
facilities
about. Exactly. And the monitoring na me kan no I am a reference AC wa jura no and one na ebe shemu deal so that and once the hospitals know that, now we look at what is happening in their facilities, write letters to them and ask them to come for meetings. Remember obia sebi ashen we and everything.
Obi my in some no for malaria test no how much you pay to the hospitals now for a pregnancy that's can no we
ultrasound is the same thing.
Okay, no, so
it's the same thing. Sky for antenatal care.
Antenatal, no.
And also I was saying.
Okay. Meaning the typhoid and so will be the same, right?
Of course.
Okay.
Of course, Obi.
Okay. Where's Obi? My NHIS card expired somewhere in around 2015. The consistent demand by health practitioners for money, though, my card was active, then discouraged me from renewing it. My question is, how do I get it reactivated at this juncture? Finally, what's the limitation to what I stand to benefit from being a beneficiary or subscriber? As for Dr. Okoe-Boye, he is too solid. He for top president at all cost. Jomo Pokwase Festus. anyway a brain. Obi, I just tuned in. Please ask Doc if the NHIS covers X-ray. Kwejo Osaibonsu. X-ray.
Obi so say na me kan no. Obi aba no or chest complaint.
Chest, yes.
We a doctor. Wa hwe na wie no watie the chest. We or the air no bronchial breath sounds sound out with your stethoscope
sure.
or chest infection.
Sure.
Ebia before we chose one pneumonia. We say one chest X-ray. Bundled sky for pneumonia. As a diagnosis on health insurance, it covers the things you did to arrive at that.
Sure.
And no socially speaking, you are not supposed to pay anything.
Okay.
In fact, I just checked my list, Obi. Now, some of the procedures, my home mastectomy. So the mastectomy procedure to remove the breast.
Breast cancer.
Breast cancer, yes. 1,213 Ghana cedis. That's what we pay, the tariff. Health insurance, Obi craniotomy procedure with trim, with your 2,000 plus. Hernia, crudo, we pay 991 Ghana cedis. I don't know how crudo now. Laparotomy. Chese ye pai uyem aye ade o 1,900 Ghana cedis. Enti look, Obi, let me be blunt here. If Obinya appendix, ebi a onya ofie otie mi na ne yem ye ne ya, ne yem aye didindi ye cause be say oh, we wanya appendix na say no operation Obi. Insurance so e was so ye tua about 2,000. But guess what, Obi? Ebi a wuduru ho no, ye hwe onua no, e was say yempe in Siobi, every room because why we every 50 days say cotton and bra. Now, yaji want to what? You do 2 word no before the operation. I was saying for between 2 pass. Sa to mano ebia any insurance. They say 50 cedis 100 Ghana. Ya rush work of theater reach doctor na operation. Nyame adom appendix no ebia apon ya yi ya bibia obeda ho. Obeda ho nso no edro no insurance cover now so painkiller bi ya won say uti o ya pa painkiller no ba ko beji wo no eni so amount of 50 cedis so far 150 Ghana. Obi what the how did you anopa ewia enumre after 1 week say no ya discharge o ya ko sha o insurance o bill no 250 Ghana cedis 1 week. What the admission, what did you anopa ewia enumre, what the how everything ya operation doctor everything one fandro ya wo IV fluids ube coffee o dey bisu ko yes 250. What is happening now is that about 2,000 of your money possibly your feeding also will be paid by insurance ni nyina no ya fa ma o it is at 250 now otua no o ye mistake now ko ka say Okoe-Boye me get card biom because me call reach call here pay 250. Who told you that it takes 250 Ghana cedis to go for surgery, sleep in the hospital for a week and go home? So what insurance has done is to make it possible to stay alive, but you have incurred a cost which will not take your family to poverty. Oh, now your bar, oh your bema, oh you him, no any card, no your mistake. I can say oh last much is coming ho and tibintia not down bed drew hospital there call operation. Card obefa obetia because insurance is not with you. What you know admission on the ward obetia. Adriani obedi morning afternoon evening okita insurance we pay for food. If you don't have insurance you pay. So Obi, I say it everywhere I go that you are way better off
with the card than without it.
For any money you pay, it cannot even be 40% of what insurance has paid for you.
Sure.
We will continue to work to remove all charges. Now me inspect me catch me say kofakas in bra. Me near brick cards, Dr. Okoe-Boye. Me inspect card on me fee. Oh, tie me now insurance judgment too far. Ma who be that? One sheda or relative bedroom hospital no, you might regret it.
Sure.
So please, as for the politicians going forward, let's engage in real, honest conversation. How do we get all the money to come so that will be me by myself for prostate cancer, health insurance, share, studies on consultation to add prostate cancer to share. There's no prostate you are on your own insurance into ya. Because we share do insurance in this. You see the baby account one share bedroom. You bill Brian and amount to me. So let's find ways sika eji wa health insurance dey no mu
dey be increase
but who can say oh and am share percentage release no e be aduru there say the insurance na gu who ka sa jobusu ama wa betna ministerial office e won cry na odi nya power na obe rich be o na mo ka cha say ona bibi anko yie na pesika man so me pacho let's be frank with ourselves obi Okoe-Boye and cancer health insurance bibia perfect wo me a doctor me person yare bia betu akoma kra obi wo ha de ohia ye valve ye be ye small operation ebi mu kra say wo kwa brocha onda outpatient surgery ye be pai wo akoma kakra na di machine bia hye ho ebi obi wo ha na akoma na mbo yie o manu pacemaker keke obi say onim na ko ye pacemaker kolebu obi fees na ko change na no your own Abai does not cover. But why should we have a country where they will pay for malaria, but they will leave out atrial fibrillation or heart surgery? Why should you have a country where they will treat you for typhoid? They will cut you up to fix and remove a child. But when you have a kidney problem, they say that one is not part of it. Sure. Why should you have a country where you treat breast cancer? When you see a man with prostate, you say you are out of here. You cannot continue like that. Yeah. These are the conversations. These are the issues. Let's ask the leader, politician, you want to lead. How do we get this addressed? But if always says, oh, my conscious mama wants to release them back. Meanwhile, who can account or here we know? Or say even an Ajo Mama, it was not 100%. So if you let's go with Akando's chat. Why is it that during Muhammad's time the releases were not 100%?
No, some of us just say Muhammad knew 100%. But now a yes saying Momo Diano.
Obi, I say Obi Adriani. Obi Adriano didn't kakra. But Udi Sana no mala. The Obi chain all meti 2 spoons. Now Adriani bibia sebi chrono ana access easy no obi all start here na anything. So the point I'm making is that because discretion has been applied in the past, now those in the later years with discretion, they will apply it more.
Sure.
So this is the honest conversation, and I have strong belief that we as a country, we have the resources to handle every disease condition. We must only be honest and frank to engage in the right conversation. Not looking at figures that ask yourself, why would out of 1.3 billion I cannot be interested in the 127 which had 2021 written on it? just your friend of navigation or navigating until Ninsabe can figure. And they say no, all these figures are right too. But if you are fan who could in a chair, insurance cry was a foul. So let's engage in honest conversation. And I believe that things will be fine.
Dr. Bernardo Okoe-Boye and your training Kano. Yes, but maybe one son no we say Obi okay good. I'm a SNIT contributor, yet I was charged 28 Ghana cedis. I renew my membership each year, but I've never used it. Don't they have a cashback policy? Wouldn't even buy Samuel Brian Boabe. Now Samuel Brian was on common to 500 Ghana cedis. Now the whole year 28 cedis news. Charlie. But loads and loads of messages, I tell you. Messages, no, the interest in the topic, no, it was so messages, no, it does. Unfortunately, we cannot read all your messages, but we would forward some of them are very important to Doc Nafi Abua in some of the decisions we may make it going forward. Obi, please ask Doc, is urethra swab scan? Urethra swab scan covered by NHIS, because I learned some hospitals are charging 150 to 200 Ghana cedis just for that scan. According to Dr. Okoe-Boye, in January 2017, the last payment made to the NHIS was April 2016, which was 8 months arrears then. The NPP said then that NHIS was not functioning. Now the last payment made was September 2022, which is 7 months arrears. So how does Dr. Okoe-Boye justify his claim that the NHIS was working now based on the data presented? Some were mile 7. Hi Obi, please Dr. Okoe-Boye, I went to a Jura hospital and the doctor prescribed some drugs for me, but at the pharmacist told me they don't have some of the drugs, so I have to buy them, but they still went ahead to claim it from the NHIS.
So that any American say, apart from committee where American report, we also have clinical audits.
Yes.
Where we clinical audits. Your teams go around the country randomly.
Okay.
Share through documents. Say, oh, Jim Crawfordska. Look, I just read about the refund that taking place with Jura. Nipa bad in quotes. Obi, what? Some monetary enya dia. Idea was on your one share now.
Sure.
Enti, who said the AI me confidence say we can do something about these illegal charges in this. You can take even 2 government hospitals in the same region. Bakun tan jinema on.
Yeah.
Already open. So some act with impunity because they know monitoring is weak.
Sure.
But Misuna, I was not in a hurry to try entering hospitals and showing force or something. I wanted to do us to have this conversation, the awareness, have these empirical reports with specific comments where even my people met all management. Everywhere they go, they met the management. So that when we start now to move and apply sanctions, you know, grounds really are solid. Don't be surprised that one day mature letter I revoke the credentialing for a big hospital. We will intentionally do that. Hospital can see our misbehaving.
Then we revoke.
And you see, Ghana, Okoe-Boye hospital, when you meet 100 people, 90 go there because of health insurance.
Sure.
What it means that any health insurance can come from for hospital because BBI is easy. In fact, only insurance Okoe hospitals, even government hospital, card you about 20 cities. You start the process over card. Now I trust the honorable Nabano 20. Now say card here 20. Over for consulting room, I go PL lab. Obi. Over there.
What's can you answer?
We are a country in progress.
Yeah.
Let's get first on the insurance. Let's also be active participants.
Yeah.
We are even trying to do health insurance fan clubs.
Okay.
Obi decide here by here called retreat me, so that people will know more. They will even become advocates. They will give us feedback, and then we and the providers will act as Dr. Okoe-Boye fantastic. Oyobia, Odi Asemba, Onyabote, Obetie. Look, there was one medical superintendent, North Obi. Only they are publishing the rates, charges are OG on the hospital. Government, Obi try rates in the picture. And I see any 2 platforms. And Okoe-Boye invited to back across here. Now, and chat with 2 minutes free. Also, on him said never wait. He do crime.
That's really interesting.
And Obi, just the charges are any approved. No one's out publishing the official. And I want to under it signed by management.
Can you believe that?
The management I won't. So Obi, with time, it will be well. Now,
sure.
I'm into Nyumbako. Now, me too. You are not my chair. The Babako na miko.
Okay.
Nia Yehovah. Shirano na we Shirano. Nia Yehovah. We Shirano na we Shirano.
Ekosiisen on assembly.
Oh, nipan to me say. Nia Yehovah Shirano. Oh, na kwenina. Yenshira. Only bound to me say, Nya Yehovah we Shirano. Oh na kwenina. Yenshira. Obi, between you we my Dr. Mahmoud.
Dr. Mahmoud Baumia.
Ebi awonu Nyankopon enso no mu. Omano ahondin. Akoma pa okita no. Omano enko very far. Na the nyame pe na oye. No say David now our back of the desert. Na nkofo 11 asa line. Ya hu tintin no na prophet ni nyame say take your time. But man looks at the outside. But I look at the heart. He's a man with a good heart. My prayer is that God would be kind to him. Me, I don't have power. The one who controls the affairs of men is the Almighty.
Yeah, that's it. Dr. Bernard Okoe-Boye in your training can Ekosiisen so ne yebeda ne ho aba ye ba Ernest Adomako abekansa wo studio